Good afternoon, everyone. And let me start by saying that Barbados continues to record increasing rates of newly confirmed COVID-19 cases. As you are aware by now, the Barbados COVID risk level is evaluated using 3 metrics: the R effective, the case counts, and the positivity rate. The R effective rate today is 1.2, and that suggests that there is spread within our communities. We like that rate to be 1 or less. And in addition, although there has been some fluctuation in our positivity rate, it continues to trend upward, with the highest being recorded at 26%. Many of you may know that I reported 2.5 weeks ago that there was a single case of Omicron in Barbados. I also at the time indicated that preliminary testing done at the Best DeSantis laboratory, based on what we term as S-gene failure, gave a good indication that Omicron was widespread in our communities. To date, we have gotten an additional 17 out of 20 samples from CARFA, and those 17 samples have been positive for Omicron. In addition, we have had close to 100% concordance with the samples done at the Best DeSantis Public Health Laboratory and those of CARFA. The Ministry of Health, within the last 4 to 6 weeks, has produced an Omicron surge plan. The pillars of this plan are self, home, and quarantine isolation, particularly looking at self and home isolation as a method to get us out of our current situation. 2, the protection of the vulnerable. 3, an enhanced vaccination approach, which embraces the use of boosters. 4, risk communication. And 5, engagement in critical stakeholders. I'm here to report that many of the elements I just raised in the search plan are currently operational. But where we are at as a country, we have outbreaks in several of our institutions, within the geriatric hospital, within the psychiatric hospital. We have 2 nursing homes and 1 children's home. And the spread of infection in these hospitals and nursing homes is testimony to the level of infection within our communities. In addition, you will hear this afternoon that how Queen Elizabeth Hospital is impacted at several of their levels of operation. So we have put some key strategies in place with respect to making sure, first, that the Queen Elizabeth Hospital is given some space to do what it needs to do. What I mean by that is that we are actively going to be rolling out 1 to as high as 3 satellite sites. These satellite sites are not going to be school-based satellite sites. These satellite sites are intended to provide care and support for individuals who are either ill or moderately ill. Remember that we have a coding system. Greens, in home isolation, we have a coding system. Greens, yellows, and reds. Reds go to Harrison's Point. or to sunbathe. The yellows are assessed by Dr. Grandison and her team, and the greens are expected to remain at their premises without leaving their homes for the designated period of isolation. We can manage this type of system, but we need the full cooperation of the public. The last thing the Ministry of Health will like is that persons who are in isolation are breaching the isolation protocols. When you are in isolation, you are deemed to be infectious, and therefore it is highly important that you remain in your homes, at your locations, and stay put. We will continue to work with all our partners. I just would like the country to know that we have had meetings with the Barbados Defense Force, the Royal Barbados Police Force, and other first responders in Barbados to make sure that they have their systems in place to be allowed to respond to the pandemic as we see fit. As the Minister has indicated, this is our third wave, and I am absolutely sure we can get through this together. I have said before that there's some responsibilities on the Ministry of Health side, but really the responsibility to get through this pandemic is to make sure that the public does the tried and tested arrangements that we have indicated in the public on several occasions. Therefore, our metrics are up. Based on our projections, we had some projections by the University of the West Indies, and they indicated a wave of about 8 to 10 weeks. We believe we are in week 4 to 5, so I believe we are somewhere in the middle, and I will hope shortly that our numbers start to trend back downwards. So those are my opening words, and I hope that my message goes to every Barbadian household that we all have to play our part in managing disease at this point in time. Thank you so much.